Good morning to all. Am I audible? There is some technical problem. Please bear with us for a while. They are just downloading the presentation. మీ వాళ్ళకి చెప్పనన్నా చెప్పాలి కదా కనీసం పిల్లలకి కాదు నేను చెప్పిన టెక్నికల్ ప్రాబ్లం ఉంది కొంచెం మీరు చేయండి స్టార్ట్ స్క్రీనింగ్ చేసి ఐజీకి పంపిస్తారు
ఐటీసీ పంపించారా మేడం?
ఫస్ట్ ఇయర్ కదా
మీరు ఫస్ట్ ఇయర్ పంపించారా ఐటీసీ పంపించారా? ఐటీసీకి పంపించారా?
ముందు అదే ఉంది కదా
చూద్దాం. అదే
ఫస్ట్ ఇయర్ క్రియేట్ చేసినట్టు మాకు ఎవరికి
ఓకే
మాకు ఇన్ఫార్మ్ చేసి చేస్తాం. మీకు ఎంత టైం పెడితే మన అందుకని
ఎప్పుడు పంపించారు మేడం? సుగుణ వచ్చింది. ఓకే నేను రాసి మీకు ఇస్తాను మేడం.
నెక్స్ట్ టైం మరి సెకండ్ ఇయర్స్ కి క్లాసెస్ ఏమని పంపించిండ్రు ప్రిన్సిపల్? ఇందులో మండే సెకండ్ ఇయర్స్ కి క్లాస్ ఉంది. మరి ఆయన సెకండ్ ఇయర్స్ కి లీవ్ బికాస్ ఇది వలన రాశారు. మీకేమైనా వచ్చిందా?
మాకేం రాలేదు మేడం, మరి తెలియదు.
అయినా నేను అడుగుతాను.
అక్కడ నా ఫోన్ తీసుకో.
అది కాదు
ఫస్ట్ మిమ్స్ ఫస్ట్ మిమ్సా? ఓకే అయిందా మేడం? చేశాను మేడం. మీకు డెస్క్టాప్ మీద పెడతాను మేడం. పర్లేదు చూడు మా వస్తుందా? ఓకే
వస్తుందా? నేను మాట్లాడుతుంది వినిపిస్తుందా? ఓకే. సో good morning to everyone. How are you all doing? So let's start without wasting further time. Today is it will be very interesting. It's an interesting session wherein from the time we are born we are just doing the same thing till date. What it is, just guess what it will be. It is learning. So you are learning from the time you are born. Is it not? Do you all agree with me? Yes, no. But today the learning is something different. This is in the context of doctor patient. So when you want to know your patient, then you should find out his learning skills as well as his lifestyle. So let's see. Uh, these are your specific learning objectives. You should know what learning is and your different types of learning. Then the principles of habit formation and sources of frustration. I think if there is time, I will uh, do it. Otherwise, in my next class, I will try to cover everything. There's a lot of time for you all. You will be giving your community medicine exam in the 7th semester. This is, you had to hear to the lecture and try to understand, and then you should try to build on that. Self-directed learning is the best method of learning. So now you all are adults, and adult learning is completely different from uh, children, means whom we teach. So children are taught in a different way, and you all are adults. So try to do self-directed learning, and whenever you want something from us, kindly feel free to reach us. We are available in the community medicine department, but I am at the TB vaccine trial site. I am the investigator. So this is here only in the premises. So let's start. Let's see what learning is. So you all know that learning is necessary for survival and progress. This is all in general terms what I am put it on the slides. But coming to patient and as a doctor, we will discuss at breadth. Okay, we'll discuss in length, and we'll see what are very important from the point of being a physician, and what the patient is, what is the patient's learning styles and his lifestyle. These are the two styles which you should know if you want to ensure that your patient should comply with your instructions, and we'll see that. So this is all in general, like you all know learning is for survival, progress. It's not only acquiring knowledge, but it also helps you to build your skills, then your habits and your perception. So your perception completely depends on what you learn in your life. So how you perceive the things about the beliefs or values, etc. Same thing like you, your patient also has certain perceptions. You have to know what are his perceptions in terms of that disease. So let's discuss about it in length as we move on. This is all general, like it depends on intelligence, motivation, and motivation needs. It's a continuous process. Both consciously we learn and unconsciously also we learn. Yeah, like this is all totally general, but I had to tell you all because you all just entered the medical school, so I should tell you all about what actually learning means. I know in general you all know that, but when I discuss in context of patient, then you should not be lost. You should know, yes, 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 yeah, this is what we have to do. Okay, then learning, what does it do? It brings about a change. It involves change, and the change is stored in the memory. Like when you are entering the medical college, you do not know anything about medicine, but when you leave the medical college at the end of your internship, that time there is a change. You have stored so much in your brain, that is memory. So all those you are going to apply as and when it is needed. That is only learning. So remembering and forgetting, you please note that a number of studies have been conducted throughout the world, and they found that 40% of the patients, they forget the information what we provide them. Like for example, let's take an example of diabetes patient, because you all know what diabetes means, and you all might have come across like your family members, one of them may be a diabetic, or your cousins or extended family members, or your friends, parents, or whoever it may be. Like that's why I want to take an example of diabetes. So it has been found out that 40% of the patients, they forget the information which we provide to them. So how is the best way to ensure that your patients are reminded, because only 60% can comply with your information which is provided to them. That may be in different forms, which I am going to discuss in detail. So then we'll see what the patients, how we had to means find out about their learning styles based on their lifestyle. And then we had to help them out, enable them. These words are very much used in public health. So, but you'll be hearing again and again, and you will be learning. So, that is one important thing which I wanted to share with you all, that tomorrow when you are as a doctor, when as a physician, when you want to deal with your patients, you please remember that only 60% of them remember. So you do not know who that 40% is. So you have to ensure that, assume that all of them, whether they remember or not, which is the best way to ensure that they remember what you have told them. So that is important. So once they forget, there is a lack of commitment to take recommended actions. They are not interested because they forget. And when you ask them, did you do exercise? I forgot. నేను మర్చిపోయాను. You all know Telugu. నేను మర్చిపోయినమ్మా. మర్చిపోయినా సార్. Because 40% forget. You all might not be knowing this, but today I am giving you the information. So what we had to explore? We had to explore some techniques to enhance memory in the patients. Let's see. This is completely different way of teaching this important topic, because last class I taught you all about the emotions. Here also some aspect of the emotion I will touch. There is something called conditions. So what are those conditions which will control a patient? It is a, let's start with intelligence. So the patient's compliance depends on his level of intelligence, that is his mental ability of an individual. So activate this sensory, motor, everything you will learn in your anatomy and physiology. So I'm not going to go in detail. This is like an functioning of the body. Let us think, because you all haven't started your classes, or it's too early for you all to tell about the sensory adjustment, motor mechanisms, etc. etc. I want to tell something which you all can understand and ultimately apply the same when you become a physician. So the mental ability is again related to various factors. You all know heredity. When someone is very like born intelligent, we say some of them, oh, she's born intelligent. That is nothing but it is natural, like heredity, maybe heredity. And it's not only the heredity, other things like nutrition also plays an important role. And then your intelligent quotient, another part. All this is your mental makeup of an individual. Why I am telling all these things? You have to think of your mental makeup of your patient to ensure that your patient understands what you tell. Got it? Okay. Then just I give one simple example. When you look at children, they are of different types. Some may be slow learners, some are very quick learners. So when they are slow learners, we immediately tell that IQ is poor. How are we saying? It is based on their mental makeup. and you assess it. So that is all you want to learn in terms of your patient. These examples are in your general life. But why I am telling all these things, so that you will connect this part to your patient management. Got it? Okay. So you just as per the studies, as per the documentation, it has been seen that maximum learning takes place between 22 years to 25 years. If your patients belong to that age group, you are very lucky. But most of these chronic diseases like diabetes, hypertension is high blood pressure, cancers, then mental health problems, all these are chronic diseases, and especially the lifestyle diseases which I have enumerated now, like diabetes, high blood pressure, all these occur at later age, wherein their memory is also not maximum. What does the study say? The maximum learning capacity is between 22 to 25. But you are getting patients who are like 50 years, 55 years and above. So after 30 years, it declines. Sharpness declines in every individual. So all these things you have to keep in view when you are treating your patient. Ultimately, it is the patient whom you are going to deal with. So important thing is necessary conditions should be available for efficient learning. But not everyone is lucky to have all the conditions. Your patients are diverse. They come from different socio-economic class, all these things. I don't know whether you are taught about the social classes, but they will be teaching you in community medicine. So it all depends. So you have to identify kinds of learning which will fit your patient. That is called learning style of your patient, not yours. Okay, it may be little difficult, this topic, but I want to make it as interesting as possible. Then you have to select the methods, different educational methods. Like some of them may be illiterate, they cannot read and write. Then what is the method you will use? Maybe some pictures you can show. Some handouts, pictorial handouts, and talk about it. Or you can have some group discussion of same patients and then start having a discussion. This is because they are illiterates. And then one example I want to give you all this, because you all are aware of heart problems, heart attack. You always tell, my uncle had heart attack and is admitted in the hospital. My mother is not well, she has a stunt. So all these are coronary heart diseases. And if we want to talk about the risk factors of coronary heart disease in a group, what are the methods which you like to use? It may be group discussion of same people, like a peer, and wherein when you talk they will start discussing and they will come out of their problems, because all of them belong to the same diabetes patients. Am I clear to all of you? So, experiential learning. This is based on, it is influencing the beliefs and attitudes. Like for example, I will tell an example of belief and attitude in a diabetes patient. What he believes and what is his attitude. One of the patient, he may believe that as aging is physiological. As he ages, it is normal to get a disease. That is his belief. And his attitude is, okay, it is part of the life because I am aging, I got a disease. He doesn't want to seek a health care. That is his attitude. Try to understand the meanings, because these are very important for you all, because in every class every faculty, whenever there is something to discuss, just repeat the same words about values, attitudes, beliefs, etc. Because our patients have their own beliefs, their attitudes are different. If you want to deal with your patient, you know their beliefs. Listen to them carefully, what they say, and then you can give an advice. You can have a dialogue with them, or you can negotiate with them based on his beliefs and his attitudes. So, and if you want to bring about a change in the behavior, like the person who tells that I am aging and I am a diabetic, doesn't matter, I don't have to go to the doctor. It's so not nice to see a doctor. I don't like that environment. That is my attitude. Then what are you going to do? You have to train them, the skill training. You have to train them in such a way that you have to bring about a change in their attitude. That is the whole purpose of a physician. Physician's role is not just to prescribe. It should be a holistic approach. So you have to equip the learners with skills. And the skills depends on their learning style. That's why learning is important. Okay? Then practice a particular technique. For example, a diabetic patient is there, and the diabetic patient, you write some medicines, but then he doesn't remember. He forgets very often. What do? You have to develop a particular technique, and you have to ask who all are at home, and if he is a diabetic, what about his wife? Is she smart? And then she can have means she can call on him on telephone and keep an alert, and then remind him to take the medicine. That may be one technique. All the techniques depends upon what they know and what you want to tell. So it is negotiation. So practicing a particular technique. If they are comfortable, okay, fine. Or if some of the patients are very smart, they say that, yes, I do remember. Then what you have to tell, put all the medicines like for 1 week in one thing, like Monday, Tuesday, Wednesday, then you can tell Monday you take this, Tuesday like that. That is one technique, particular technique. It's a different way of reminding. And then sometimes he himself can keep an alert and then do it. The other example which I give is like the patient is asked to see the physician at certain interval. He may not remember what is the technique you like to tell him, means you want him to practice. You can tell, if he is educated, to mark his calendar. That's the easy way of doing things. Do you all think on that or no? In the similar way, I'll give another example of breastfeeding. Breastfeeding is very, very important because it will bring down the deaths on the newborns. So we have to promote breastfeeding. So for that, if a mother, first time she became a mother, but she doesn't know how to feed the baby. It's a technique. Then what you have to tell, how she has to hold the baby, how she has to put the baby to the breast, how much it should be, how much chin should be seen, everything. And that technique, you have to ensure that she goes on practicing so that she will learn to do it on her own. How do you do that? You can counsel and you can also demonstrate. And you can also tell the mothers who already had the past experience of breastfeeding and who will share their experience with the new mother. So these are the examples which I want to tell you all, which you will be coming across in your medical school, in the hospital. So these are very important. So when you are seeing, you have to remember that Dr. Subna, she has told us about learning and how we have to help the mother to see that she will practice the technique of breastfeeding. And you have to counsel, you have to ask the previous experienced mothers who may be in the same ward to share their experience with this new mother. This is how you have to develop a technique. That is called different techniques which you will develop and ask our patients or the mothers who are new mothers, means first time they have delivered a baby and they do not know how to bring about a baby. So such things are very important, and the our patients and our, like, if you're going to become an obstetrician, they expect you to tell them. They'll be very happy if the physician tells all these things. Unfortunately, this is not taken seriously in our country, but in other countries, if some of you may be planning to go to developed countries, there it is part of the work of the physician to tell everything, counseling, then everything they have to do. Of course, there are sessions for them, separate sessions, but ultimately it is the physician's responsibility. So it's now the time for you all to start learning and think over and try to apply whenever you get a chance. So, participation, I was telling you all about participation and attention. The attention which is needed for the patient. When a patient is talking to you all, don't start looking down and scribbling something. No, you have to listen to the patient. You have to pay attention. Then only your patient feels happy. These are all the conditions. And like, you can also have it if educated group is there and they all come together, all the diabetics, a small group. You can have a debate. You can also have a group discussion. And then find out what they think of how to manage, what are their goals in management of high blood sugar among themselves, and how you want to help them to achieve their self goals. That is the whole purpose of learning. Okay. Then opinions and values, you have to listen to them. Each one have their own opinions. Some of them say that Ayurvedic medicines work better. Some may say homeopathic medicines work better. Okay, fine. Listen to them. And then what you want to tell, you can tell. But in a nice way, so that you can bring about a change. Ultimately, what happens at the end to achieve a self goal by a diabetic patient or a group of diabetics? They take up a decision. They make a decision. That is decision making. Then a learning situation, I was telling you all, like asking a experienced mother to come and talk to a new mother. That may be one of the situation. The other situations are very common wherein you are now in this institute. Institution is a place, it is a situation wherein you all learn from as teachers. You also learn from your textbooks. You have audiovisual aids. This is an audiovisual aid which I am using. Then it all promotes learning. In the similar way, you can use all these situations for your patient or patients. You can, at the institute, you can make them all sit together and have a group discussion. So, who are your teachers? Teachers are your healthcare providers who will talk to them. What are your textbooks? The textbooks may be like in the form of a brochure about the management of diabetes, which you can give it to your patient. And what are your audiovisual aids? It can be a video. They all promote learning. Did you all understand? Is it interesting? Okay. Then next comes your motivation. Motivation is very, very important to facilitate effective learning. Effective means what? The right thing. right thing at the right time. I will not tell the definitions. The definitions you will come across as we take more and more classes. Probably when we teach you all about the health management, planning and management, that time we are going to tell you all about effectiveness, efficacy, efficiency, all those things. Now you don't have to worry, just learn. That motivation facilitates learning. Just remember that. Do you all agree with me? Motivation facilitates learning. If you want to be, you were thinking of becoming a doctor, and then who has motivated you? Maybe your friends or your family members, mom, dad, or your own sister who is a doctor, or his brother who is a doctor at home, sibling. So many of them are there who may motivate, or it may be self motivation that you yourself looking at whatever the factor may be, the condition that it was self motivation uh, for which you are landed here. Then encouragement. Whenever your patient does something good, it will, hey, good. That's a good achievement. You have to encourage them and you have to praise them. Just not keeping quiet like that, and then okay, patient has come. Okay, it's not a burden. It's you really enjoy doing your work, taking care of your patients. So you have to encourage, you have to praise them, and sometimes you have to reward them, and you should tell, you listen to their success stories. Okay, it's important. So all these will motivate. And physical learning, for example, some of them are unfortunate, like they are born deaf, they are born dumb, and there some are chronically sick. Those people are special. They need special attention. They cannot learn on their own. Such people, you have to think over the techniques which will fit them and encourage them to practice. One example which I wanted to share with you all is about the mental health, especially after these lockdowns, everything, Karuna. Everyone are worried, anxious. They are have the fear because something can happen to them and all. So all those patients, when they come to you, or to any physician, and then you have to really take care of all those things, listen to them, and then give them appropriate advice. So what are the three different types of learning? One is cognitive, the other is affective, the other is psychomotor. In the cognitive, it is the knowledge. Knowledge means what we inform, we give to the patient. Again, I say, I am teaching learning in the context of patient and you as a physician. Please remember that. The general learning, yeah, of course, you all know what learning is, what you do every day, everything you know about it. But this is in the context of healthcare. So you have to give the knowledge to the patient. You have to provide information about the diabetes. You have to tell what are the important things, what diabetes means. You must give them the knowledge. You must tell that there is increase in the circulation of your blood sugar. Blood, normally the sugar is essential for the body, which you will be learning in your physiology, and without blood sugar the brain will not function. These normal things which you learn, you have to tell them. But in your case, the sugar levels have gone up due to blah blah blah, which you will learn in your medicine, and that is the knowledge. And then the affective type of learning is the attitude. The attitude, you had to talk to your patient and then find out how he responds to this disease. What is his attitude? Whether it is a positive attitude or whether it is a negative attitude. And then your psychomotor is nothing but you must ensure that your patient learns, acquires certain skills to manage himself, self management of diabetes. Like he has to wear his shoes, he has to keep his feet clean, dry, and always use footwear, so that because he loses the sensation because of the high blood pressure, the nerves are not functioning, and then he may develop ulcer, and then his uh, lower limb or the foot, it can be amputated. Okay, so you want to teach him the skills which will protect his body and all the different organs in the body. So you must give him the skills, that is psychomotor. So now you know that there are three types of learning. One is cognitive, giving the knowledge, information, and then affective is attitudes, finding out is attitudes, and the third one is you have to give him the required skills to achieve his self goals in management of a disease. For example, diabetes. Okay, because you all know about diabetes, I want to tell about diabetes. Otherwise, I have ample examples, but you all are just in first year. I just don't want to just dump everything, because you will be learning slowly one after the other. Yeah, one example I wanted to give about the psychomotor skills is about breastfeeding, because I have uh, told you all in detail about breastfeeding just a few minutes ago. So that is a psychomotor skill. Yeah. Of course, I told about the reflex condition, and the other method, other types of learning are trial and error. Just try it whether it works or not. If it doesn't work, okay, error. And then observation and limitation. By observing, you learn certain things. By doing, you learn more. By remembering, you do still more better. Then the insight, you want to find out, oh, what happened? Think over. That is insight. Demonstration, by demonstration, you learn. I think demonstration, the best example I can give you all is what you have learned in your intermediate or in your 11th and 12th standards in the laboratory, wherein your teachers or the lecturers, they have demonstrated how to do your chemical reactions, everything in the physics, about all drawing of those different things like magnetic, I don't remember much. Then also about the, did we do about anything related to banking of road? No, I don't remember. That doesn't matter. So demonstration is doing something and showing to us. In the similar way, what are the things you want to demonstrate to your patient and teach them? Okay, that is demonstrating. The other type of teaching your patients is by in the field. In the field, collect the same peer group and then let them share their experience with each other, and then try to solve their own problem. That is problem solving. So these are the different types of learning. It is especially for the patient, in the context of patient. Educational methodology, of course, it is an integral part of our health education. I was telling you all that in whenever you treat a patient, it is the comprehensive approach. It is an integral, health education is an integral component of your comprehensive health care. So you should never forget to educate your patient. For that, you have to know all these things. The method should be relatively specific. You should focus on what is required for that particular patient. And then if you want to teach for a community, like for a group of villagers, you can use a mass media, show them a video, or if it is a small group, around 5 to 10 of them, have a group discussion. And then you can also do, like, some of them are very clever, like they are suffering from diabetes since 10 years and they are maintaining their health. They are in good condition. What do? Let them play a role play so that all other patients, they see what he has done, how he has done. Or role play also can be like someone who is very smart and act as if like he or she is a diabetic, or one of them we can be like a physician, and then we can play that role and try to solve the problem. This can be done in between the patients to find out the problem and solve it and bring about a change in their behavior, that is attitudinal change. So I had taken one example of social interaction skills. We all know about alcohol. So alcohol consumption, it's not good for health. So but a person who is a diabetic and he wants to tell his friends that he doesn't want to take alcohol anymore in his real life. But what should he learn? How should he tell no? What are the things you will do? How will you help him to say no to alcohol? This is again all the what all I have told you from the beginning. So you have to apply all these things and ensure that your patient is able to tell no to alcohol. What does this need? This needs social skills. How to negotiate, how he has to tell his surrounding people, society. Sociology is nothing but society. So he has to acquire that skills and then he should be able to tell no to alcohol. Again, he should also be by himself self-regulated. He should be able to control himself that I should not drink alcohol anymore. Then only I will be able to tell no to alcohol. Got it? So that is called self-regulatory skill. And non-verbal assertive behavior. He doesn't have to talk, but he can say. It means this is non-verbal. This is non-verbal assertive behavior. Means positive behavior, but he is not expressing, but he is body language. Non-verbal is mainly body language. So measurement of learning, this is like general. I don't want to touch on that because that is not related to patient management. This is like general. Why I have linked with general is you will be able to catch up with what I teach you. So I think I will stop here. Any questions? Please free to ask me. I will get back to you all, and then I think you all know my name by now. So let me see any chat from anyone. Would you like to ask me anything? Where can I see that? Free notifications. Oh. Any questions, please? I'm not able to see, I'm not able to chat. No questions? New comment on first year. Play all comments.
First year is written there, but 2020. Okay. Done. No? Anyway, I have to first. Streaming started. Okay. Okay. Good morning, everyone. Today I am sharing one phone number for your attendance. Please put your attendance on this phone number. Send an SMS. Okay. Just look in the chat box. 9985966. So put your attendance in this chat box.